Hello, my name is William Prowse from Plantar Fasciitis Survival Guide. Today I would like to talk about trigger points and how they relate to plantar fasciitis pain. One thing I want to start off with is if you have inflammation in the heel, in the plantar fascia, you're going to have trigger points no matter what. It comes with plantar fasciitis. It's the body's natural response. The tissues around it are going to tighten up and splint the joints around the heel so that you do not move it. It's also going to send referred pain all over the foot. You might have pain in the arch and the heel. After like 4 to 5 months, the pain will change around. It might move a little bit. That usually is from trigger points. Whether you've had plantar fasciitis for a couple years or whether you've had it for a couple days, there will still be trigger points in the calf and foot muscle. After you get rid of the trigger points, you want to keep digging deeper because there's a lot more muscles that are really deep in the calf that are hard to reach. Alright, now I'm going to show you how to release most of the trigger points in your calf. Not all of them. It's not going to be exact, but it's going to get rid of a lot of tension in the calf muscle. This method's great to do before you do other methods because it really shows you where the trigger points are in your calf. So what I'm going to do is you can do this on a bed, you can do it on a mat, or anything you can. It's better to have somebody do this for you, but it's really hard to find people to do this for you. Also, you won't be able to tell them exactly where the trigger points are that you feel. So what I'm going to do is I'm going to show you just an example. You can get really creative with this. There's no real right way to do this. Just try to find a way to get a rolling pin into your calf muscle. First, just kind of go over the whole thing, roll it back and forth. You want to do it light at first. You definitely want to start out very light. Just do a couple passes, it'll start loosening up and you'll start feeling more and more places where there's more localized tenderness. So, on me, this is kind of hard because my knee's a little flexed, so I can't go all the way to the top of the calf muscle. If you're laying down and you have someone do it for you, then it's going to be a lot easier to get the whole calf muscle. But for me, most of my trigger points are right in the middle of the calf, right on the inside. And so what I do is I just go back and forth over that spot until the tenderness subsides. And this can take anywhere from 30 seconds to 10 seconds to a whole minute. It really depends. Sometimes if you find like a big area that's just a bulging knot that's horrible and extremely painful, what you can do is just push nice, slow, steady pressure right on that trigger point. Also, keep in mind that you want to do the inside and outside of the calf muscle. There's lots of muscles in there that contribute to plantar fasciitis pain if they are dysfunctional. So right now I'm doing the inside of my calf muscle, and now I can go to the outside of the calf muscle. Another area you can work is the front. You're going to have a bone, the shin bone, which is very sensitive. You don't want to get this spot. There's not much muscle there at all. But you can get the other side right here. There's a big meaty portion right on the outside front of the calf. Or not calf, the outside front of the lower leg. You can just go back and forth on that. That works really great. Also on this side, we've got these muscles on the outside of the calf muscle, and what these do is cause the foot to evert like this. And those muscles really, if they're dysfunctional, they're keeping your foot everted all the time when you walk. If they're nice and tight, which we don't want, it's always going to be doing this with every step, and that can contribute to plantar fasciitis so very much. If the other side's really tight, you can get the same kind of thing going in a way that causes more stress on the lateral plantar fascia. You just need everything to be released so that this thing can function properly. It has so many different movements and so many different ways that it has to control itself that if anything's out of whack, the whole thing gets out of whack. Alright, one of my most favorite techniques for trigger point therapy is using the opposite leg's knee and driving that into the calf muscle. The reason this is so effective is because when you sit there and you use different methods and you massage or use your knuckle, you massage into the calf, you're not that strong to put that much pressure into your own calf muscle. When you use your opposite knee, you have the whole weight of your leg pushing straight into your calf muscle. So in the last method, we've used the rolling pin to find out where all the trigger points are and all the tender spots. Now what we can do is go in that spot Massage it out, just like this. You want to start nice and lightly, but you want to ever so slightly increase pressure slowly. And this can take some time. There is definitely an art to going nice and slow and knowing what to feel for. The learning curve is fast though, and once you find the pain relief from these methods, you will instantly start using them all the time because they work great. Just be very patient and let the muscles release on their own. What you will find also is nodules and taut bands throughout this whole calf muscle if you have plantar fasciitis. What you want to do is find exactly those spots. Let's say I have one right here, and you want to push it up against the knee like this. That's the good thing about the knee trick, is that you can go on the inside of the calf muscle like this. You can go directly on the back of the calf muscle, and then you can go on the other side, on the outside of the calf muscle. On the outside of the calf muscle, those are hard to find little trigger points, but they're definitely there on most people, and they are very crucial to make your foot work properly. Also, another big area of concern is right in here. There's two muscles called the tibialis posterior and also the flexor digitorum longus. In this spot right here, you'll feel the bone right here, and then just under the bone, there's a meaty section. Right in this little tiny valley, you're going to find all sorts of little tiny trigger points. And a good modulity for this is, I made this. I just took a 2x4, I drilled a hole in it, and I stuck this little wooden peg inside of it. You can find all sorts of things that work. If not, you can just use your knuckle in that spot, or just go like this and then hold. I love this because it gets in there really deep. You just have to take this, find where the trigger points are, and hold it, and then release. It should loosen up a bit, and then start rubbing it a little bit. The two main ways to get rid of a trigger point is to rub it or to push into it and hold consistent pressure for a given amount of time. The number one thing that will happen to tell you when a trigger point is good to go is when the pain in the area decreases. So after, let's say I'm working on a trigger point right here, after doing my rubbing and doing all my other stuff, putting the knee into it, the pain will subside quite a bit. That tender spot where the trigger point is will start to have less pain. That's when you know that you're good to go. Very good thing to know about these trigger points is how they work mechanically with your foot. So let's say we have the calf muscle, the two big muscles in the back, the soleus and gastrocnemius. You don't really need to know the names, but the ones in the back compartment, only cause this to happen. They only cause flexion, causes the foot to point. The one in the front compartment, tibialis anterior, causes the foot to go up, like this, just up, and that's it. So these two fight back and forth. If this side becomes dysfunctional, and it's always pulling down this way, then this side is going to be overstressed because it's not used to that extra workload. So then this side will get trigger points, and then it gets all completely out of whack. To also add to that, the muscles on the inside of the calf, the ones that we were talking about earlier, the tibialis posterior and the flexor digitorum longus, these ones have long tendons that wrap around and connect straight to your foot. Your foot's like a giant puppet, and whenever these contract, it moves the foot in certain ways. With these inside calf muscles, they cause the foot to go like this, and we need that. We need that so that the arch can stay nice and strong and pushed in this way. The muscles on the outside of the calf, on the outer edge, cause the foot to go like this. And that's very important because every time your body hits the floor, every time your foot hits the floor, it needs to absorb this shock. And a lot of things are twisting and turning every time you take a step. And if any of these muscles get out of whack, the muscle that does its opposite action, like on this side, the opposite action muscles are on the other side, or the front muscles, the opposite action ones are on the back. If any of these get out of whack, then everything else tightens up and goes crazy. Alright, the foot muscles are very interesting. There are a lot of foot muscles and a lot of foot bones. The pain referral patterns for the trigger points are very localized. So what's scary though is, like in another example, is in the calf muscle, you can have a trigger point right in here on the gastrocnemius, and it can refer pain to your lower back. okay? That doesn't happen down in the foot. We don't have any of those crazy referral patterns. I mean, in the soleus right here, if you have a trigger point right here, you can have pain right in your heel. So we understand that the calf has crazy trigger point referral patterns, but in the foot, we really don't have that much. So you don't have to sit there and memorize every single trigger point pattern book out there. Just know that you need to massage the heck out of these with a lot of pressure. If you use your hands, you can't get most of these muscles that are down here. If you are using your hands, there is good news though. You can get some of the trigger points, and some of them are right on the side of the foot. Go slowly underneath. You'll feel a bone right here. Go underneath that, and you'll feel the meaty portion. And you'll find little sensitive trigger points all over the place. Here's one right here. Also, you can use a tool on these. This tool right here you can use pretty much anywhere, but you're not going to get nearly as much work done as when you have a foot roller. The foot roller, you can put your weight, your body weight into it, and it is just going to release all these muscles in here. These muscles are very thin but very strong. They're not going to be very easily coaxed into releasing with doing this. You can do this and it will release it some, but a foot roller is going to give you the full benefit. Alright, when it comes to trigger points on the feet, you want to start very slow. The muscles that are in the foot are very deep, and it's very hard to get down in there. So whether you're using a foot roller or a lacrosse ball, it does not matter. You want to start off nice and slow. You want to roll over the whole foot, nice light strokes back and forth. And this can take a while, and it's really nice to do though. So just go nice and slow over the whole length of the foot. You want to get the inside of the arch. See how I'm going on the inside of the foot? And then you want to go on the outside of the foot. You want to get every spot you possibly can, because there are a lot of muscles down there, and you don't want to miss any of them because they're all probably dysfunctional if you've had plantar fasciitis for an extended amount of time. So just roll it over and over. This is the general warm-up I do in the book, and I mean I suggest everyone to do a nice light warm-up. After that, you're going to know where the trigger points are after doing that nice warm-up. The part about the warm-up is that it warms up the tissues and makes it ready so that you can do trigger point work. But then by the time it's warmed up, you know exactly where the trigger points are. Right now I feel one right behind my big toe joint, so I'm going to rub nice and slowly into that area and release it a bit. God, that one released pretty darn fast. That was really good. A lot of people have it in a muscle called the quadratus plantae, and it's in the back of the foot, right in front of the arch. This one's really deep and really hard to really release. So just go nice and slow and put a lot of pressure into there. Only when it's warmed up though. And do slow pressure, gradually building up. Just go nice and easy. On the inside of the arch, you can find a lot of dysfunctional tissue. It's crazy how much you can find in there. Also, the lateral portion of the plantar fascia on the outside. Just go right in that meaty portion right there. This spot's a lot easier to get at with a foot roller, though. Much easier to get at with a foot roller. The lacrosse ball, I recommend more for arch, just right in the arch, or right in the very back. I love rolling it right on there. But the foot roller, I think, is better than lacrosse ball in a lot of ways. So you know, with trigger points, you can do too much too soon. If you put too much pressure on a trigger point, it will become tighter. It's hard to do, though. And it's a lot more safer than stretching ever. But you don't want to put too much pressure. Once the pain subsides, stop. Even if the pain is getting way better really fast, do not continue the trigger point therapy. After the pain subsides and it becomes more desensitized, that's when you stop, because you don't want more pain. If you keep going with it and you push it, it's going to tighten up more. If you stretch your muscles when you have trigger points, those trigger points will become tighter and it will contribute more to your plantar fasciitis. So what you want to do first is get rid of those trigger points. The trigger points are what's causing the pain at that point, especially with chronic plantar fasciitis. But if you have plantar fasciitis, it's going to have trigger points. Regardless of if it's been there for 3 years or 3 months, it's going to have a trigger point. with inflammation in the heel area, you're going to get trigger points regardless of what you do. It's going to be there. It's the body's natural response. It's what causes the muscles to tighten up so that it splints the joint, the injury, so that you do not move it. The trigger points also stop blood flow. They stop lymphatic flow. I mean, they are just horrible. It makes sense if you have a severe injury, but after a couple weeks of having trigger points in the plantar fasciitis, it will be the main cause of your pain at that point.